are a lot of individual connections. This is understood because we're in the middle of a pandemic. Please, we ask that everybody joining from facilities or in groups actually observes physical distancing. A humble request for all of us to actually switch on our cameras if we can. So because we have so many individual connections, I will not go ahead and introduce the network, but here in the hub, I'm joined by Professor Lloyd Mulenga, Infectious Diseases Director, Ministry of Health. We have our coordinator, Davis Kampamba, and we have Dr. Musisye, who's one of the doctors that worked in the COVID center. And of course, we have IT. In the network, we have Dr. Chitanikang. He's a physician working at Levy COVID Isolation Center, and he is with Dr. Zico. Just a brief recap about last week's session. We were privileged to have Dr. Mondemuyeta. She's the director of TB programs at CIDAS. Essentially, when patients start TPT, let's ensure they complete 6 months. For now, that's the regime we are using of isoniazid. If there is any interruption, if it's less than 3 months, they can proceed to complete their 6 months. And if it's more than 3 months, the interruption, then we have to restart. The idea is all regimes for IPT are completed within 9 months. So Professor Lloyd, we are going to start with your presentation. You can please go ahead and introduce yourself as I share.
Good afternoon, team. It's good to once again engage each other as we fight this pandemic which we have among ourselves. I'm Lloyd Mulenga, Director for Infectious Diseases of the Ministry of Health. So during this few minutes, I hope, would like to just highlight where we are in terms of trends for the infections that we have rising from SARS-CoV-2. And also we compare the global scale and we look at the measures that we need to put in place for Zambia as we have peaked with the cases. I'm sure some of you may have joined into the press brief, which happened slightly more than an hour ago, finished slightly more than an hour ago, where the Honorable Minister announced that we had more than 174 new cases confirmed for the 959 tests which were done in the last 24 hours. And that has brought the country to having 3,326 cases cumulatively. And also, we have seen an alarming rate at which we are finding positive results among those that are brought in dead. And this is largely limited to Lusaka, Copperbelt, and also Western Province. That has accounted for 95, for 80. Then we also have classified the deaths which may be related to COVID as the cause of death. And we are waiting to classify 5 more deaths. In terms of recoveries, the past 24 hours, there have been 123 recoveries, bringing the number to 1,620 recoveries. Now, this is just slightly above 50%. This has been concerning. As the ministry, we instituted measures of trying to swab all the bodies that are brought in dead. And this is for the 80 as of last week. And you can see the distribution of the mortalities are those above 50, the male and also female, with the male having a median age of 48 and the female of 63. Of course, I need to emphasize that these BIDs, when it says SARS-CoV-2 positive, we are not saying that it's SARS-CoV-2 or COVID-19 which caused the mortality. Just that we found positive test results after swabbing from these bodies. Now, this is an indicator of the transmission which is widespread in the community. And this is also related to what we have been able to see in the past 1 week. Just give a snapshot of the Lusaka cases, and also you relate these to the admissions that we are having in the Levy Isolation Center, and also relating to those that are being put on oxygen. You saw that on the 10th, we had 37 confirmed cases, rose to a day after 79. Of course, we did fewer tests when we had 16, 32, 65, 78, 102. But in the past 5 days, we are averaging about 170 positive tests a day. Then as we have seen the cases going up, we have also seen the admissions increasing. 34, we had 60. Of course, today we have 61 in Levy Isolation Center. But also similarly, we have seen the number of people that are being put on oxygen from 11 on the 10th to 42 on the 16th. Of course, today we had 17, but we are moving again more individuals who need oxygen today into Levy. So this is worrying. I'm sure you can see that the picture is changing for the cases that we are having for COVID-19. We are seeing sicker patients. We are seeing increased deaths. We are also seeing a number of cases whom we are admitting with symptoms and also with comorbidities. Dr. Folosh, you can read for us the full question.
Thank you for that preamble, Professor. So here is our first poll question. COVID-19 infection rates in Africa region are less than other WHO regions of the world. True or false? COVID-19 cases in the Africa region are less than what we see in the rest of the world. Please go ahead and poll. Okay. I know it's a good poll when I'm getting such results. COVID-19 infection rates in the Africa region are less than other WHO regions in the world. Is that A, true, or is it false? Do we have less COVID-19 cases than other regions of the world based on the data that's been presented?
How is the polling, Doctor?
Interesting. Okay. Are COVID-19 infection rates in Africa less than the rest of the world? St. Francis, please go ahead and poll. Sekai Maida, we hope you have voted. Okay. In the interest of time, I will end the poll and share the results just now. So this is how we polled. Prof will go through these and discuss which one is the correct answer. So let's just bear that in mind.
Christine. So we look at the COVID-19 cases or the infection rates in Africa, seeing that they're not different from other WHO regions of the world. Remember when we had COVID, we thought that in the early days that Africa was going to be spared, Africans were not going to get COVID. Africans were not going to die from COVID. And what we are seeing is that the picture really is the same for Africa compared to the others. Now, when you look at this graph, the African region, that is, I don't know if that is purple. Yes. And you can see it's in the mix with all the other regions. So really the cases that we are having in Africa, and there's a slide which is going to emphasize really Zambia and also other countries, especially South Africa, where we are compared to other countries. It's showing us that really Africa has been affected similarly as the other WHO regions.
Our second poll question: when adjusting for population size, Zambia has more confirmed COVID-19 cases than China. When adjusting for population, Zambia has more COVID-19 cases than China. Is this statement true or false?
I'd like to see how people react to that.
When you adjust for population, does Zambia have more COVID-19 cases than China? Is this true or false? Have we reached the levels of China already? Is this true or false? Someone has closed the polling. Someone has closed the polling. Do we have a co-host? Someone has closed the polling. There's a co-host. Okay, I'm going to relaunch that. There's a co-host. Chatonda, there's a co-host. Okay, so let's vote on that. Sorry about that. When adjusting for population, Zambia has more confirmed cases than China. Is this statement the truth or it's not true? Is it false? I had another poll come up. Okay, so Prof, you can see this is the polling. I will end the poll just now. Okay.
40–60%.
Okay, so let me just allow the network to view that. So when you adjust for population, does Zambia have more COVID-19 cases than China? Is this statement true or false? Are we there yet? Okay, we'll be attending to that later.
So it's true when you adjust for the population, when you look at the cases that we have per million people, we have now surpassed China. Now, we don't usually look at it this way. What we look at is we want to see those number of cases which we are seeing in China. Are they the same numbers that we are seeing here? Remember, China is a large population. And the fact that it is a large population, we expect more absolute numbers. But when you compare it now per million people, Zambia has exceeded China. We are, of course, below the African average. We are below South Africa. We are below Brazil. We are below the United States. But it's sobering, really, to say that we have exceeded the first country that saw this pandemic. And it needs to make us worry on what next we need to do.
Okay, after that very sad news, we will do the third poll question. The total confirmed COVID-19 deaths in Africa are less than China. So this is now deaths, not infections. Please, let's go ahead and cast our votes. Is this statement true or false? Total confirmed COVID-19 deaths in Africa are less than in China. Remember, we are now referring to deaths, not infections. What do we think? Prof, I think your information was too sobering. The voting is slower. The total confirmed COVID-19 deaths in Africa are less than what China reported. Now you're getting a tie, a proper tie, because you scared us. The total COVID-19 deaths in Africa are less than China. True or false? I'm happy I can see Dr. Kabamba there. I hope you voted Dr. Kabamba. Thank you so much. He shared a pediatric case with us, with Dr. Natasha Ngonya from Levy. The good news is that that patient did very well in the early days. So the total confirmed COVID-19 deaths in Africa are less than China. Is this true or false? This is almost a tie. Remember, we are talking about death, not infection in this case. What do we think or what do we know? So this is how we voted. Prof, you can have a look. We'll go back to this at the end of the session. Thank you all that voted.
So thank you, Dr. Foloshi. And again, when you look at the confirmed deaths in Africa, they have exceeded China. And now when you adjust again, you adjust for the population per million, Zambia is approaching China. Now people are saying, oh, only have 128. And again, we only have 28 COVID deaths, then the others associated deaths. We cannot compare to China. But when you look at the population of Zambia, if we don't isolate the elderly, if we don't do the mask up, we don't do sanitizing, we don't do physical distancing, those numbers are going to increase, and very soon we'll find ourselves close to South Africa, close to Brazil, and close to the US.
Okay, very sobering. So from this, Africa is above China, but Zambia is just approaching China, death levels.
Yes. And this is a review of where we are as a country. When you compare the past 1 month, the number of tests, we've seen that the number of tests have been, of course, fluctuating, but overall there's been an increase in the number of tests that we have been doing compared to those that were running in April, May. But you've also seen that the positivity has been increasing. When you look at the red dotted line, that red dotted line is showing us the average positivity. And you can see that the average positivity has been increasing. Now we are almost close to 10%. Now this data doesn't include the picture which we have been seeing in the last 5 days. In the last 5 days, we have been averaging 170 cases per day. So our positivity is increasing. And again, this is a worry. We are increasing these cases at a very fast rate. Remember, we had a Nakonde cluster when we had the SAGE in Nakonde, we said, oh, we have so many cases in Nakonde. Now, Nakonde was a one-off shot. Then we went into a period where there was calm and people thought that, okay, now things are under control. But again, the growth which we have seen recently, it's been gradually increasing at a very rapid rate. And similarly, if you look at the graph on the right side, it's showing us also the rate at which the mortality has also been increasing, rapid rise in mortality. And this also is relating to the first slide I showed, even where we are seeing the severity of cases also rapid. It's aligned to mortality and also the cases, the severity of the infections that we are having. It's like we have now another phase. It's another SAGE. And what is worrying about this SAGE is that it's killing people. It's causing various comorbidities. We are observing also for the patients that we are seeing, they are presenting their hyperglycemia. People who did not have diabetes before, who had their sugar levels under control, we are seeing them presenting with hyperglycemia. We are also seeing the patterns which are different. GI, which we are not seeing before. So really it's worrying that at this phase we are seeing now a different set of presentation and sicker patients compared to the early phase of the infection. And also, what we need to know is that the cases that we are confirming, they are not telling the whole story. And that's why you can see that the BIDs, when we swab for the BIDs, the positive rates are high.